Be honest. How many of you check your period app like it's gospel? It says you're safe, so you relax. But should you trust it to prevent pregnancy? Now let's talk. Period. Hi, I'm Rose, and welcome to Period, the show where we talk women's health. No shame, no whispers, just facts. And today, we're asking, can you actually trust your menstrual app? And how safe it is for avoiding pregnancy? Let's get into it. First off, menstrual apps are excellent tracking tools. Almost every woman has one. Hey, they help you know the length of your cycle and whether it's regular or irregular. But remember, irregular cycle means your period falls within about 7 days of each other. Apps also help you know the dates of your last menstrual period. This is something your healthcare provider will ask almost every visit. They remind you when your next period is due so you can plan work, travel, medication refills, even wardrobe changes. Modern apps also track mood changes, breast tenderness, pimples, flow intensity. Some even allow you log vaginal discharge and body temperature. Technology is so impressive. Menstrual apps use what is called the calendar method or the rhythm method. It's one type of fertility awareness. Other fertility awareness methods include tracking body temperature daily and checking cervical mucus. Some women use this method for religious or medical reasons when they cannot use modern contraception. For women trying to conceive, apps can also help identify fertile days, especially if partners live apart. If you're trying to avoid pregnancy, here's what you need to know. Most apps require at least 6 months of accurate tracking to understand your pattern. And even then, things like illness, stress, travel, hormonal shifts can delay ovulation, which means apps can miscalculate. Menstrual apps help prevent pregnancy about 75% of the time with typical use. That means about 15 to 24 women out of every 100 using this method will get pregnant within a year. That is not small. Women with irregular cycles, those close to menopause, or those who just stopped hormonal contraception are less likely to benefit from relying on the app. So here are some important facts you should know. First, day 1 of your cycle is the first day of proper blood flow. Second, sperm can survive inside the female body for 5 to 7 days. The egg survives for only 12 to 24 hours after ovulation. That means you can get pregnant from 6 days before ovulation. If you want to calculate your fertile window manually, track your cycle for 6 months. Take your longest cycle, subtract 11. Take your shortest cycle, subtract 18. For example, if your longest cycle is 35 days, 35 minus 11 equals 24. If your shortest cycle is 28 days, 28 minus 18 equals 10. Your fertile window would be day 10 to day 24. If that math feels stressful, there's always the standard days method. For women with regular cycles between 26 and 32 days, assume fertility between days 8 and 19. Lower risk days are 1 to 7 and day 20 to the end of the cycle. During fertile days, you must use another method or abstain if you want to avoid pregnancy. So, do you think you should trust your menstrual app? For tracking? Absolutely. For planning your life? Yes. For providing accurate information to your doctor? Definitely. So, should you trust your menstrual app? For tracking? Absolutely. For planning your life? Yes. For providing accurate information to your doctor? Definitely. For preventing pregnancy? Only if your cycles are regular, you track consistently, and you use protection during fertile days. Technology is helpful, but biology doesn't read apps. And remember, no shame, just facts, period.